1 in 8 women will be diagnosed with breast cancer in her lifetime.
Women not the only ones, of course, who are directly affected. About 2,500 cases a year are identified as men.
And as we continue to bring attention to Breast Cancer Awareness Month, Dr. Wendy is back to shed some light on breast health awareness. Good morning.
Good morning. Thank you guys for having me.
Thanks for being here.
Yes.
So we always talk about how women get breast cancer, but you're still pushing the narrative that men get it too.
That's right. I mean, Matthew Knowles just announced it yesterday that he was diagnosed with breast cancer, and that just strengthens the point that everyone should be checking and screening for lumps. We need to be doing our self-breast exams, and women should start doing mammograms. Some guidelines say at the age of 50, some say at the age of 40, and I like the idea of doing mammograms every year starting at 40 because catching an early breast cancer can be life-saving.
What about self-examinations? When should those start? I mean, is that an everyday part of life?
That's an every month thing for everyone. Like when we talk about who should be doing self-breast exams, anyone with a breast. Honestly, whether or not you are, if you're adolescent or older, basically, you should start doing breast exams. Once a month, ideally, around the same time every month, because the breasts do change throughout the month, especially hormonally. But it's important to feel around and make sure you know what's normal. People often get nervous when they say, like, well, what am I feeling for? What's abnormal? The biggest thing is knowing what's normal. They call it breast self-awareness. If you do your checks and check regularly, you know what your breasts feel like. And if something pops up in there that you're like, that wasn't there before, that's worth seeing your healthcare provider.
Yeah, see, what about women with dense breast tissue? Because that's pretty common.
It is. Dense breast tissue is common. And it's hard to know if you have dense breast tissue because they're your own breasts, right? But I think it's very important to ask your clinician, ask your doctor, are my breasts dense? Because if they are, then you would actually be qualified for a different type of mammogram, a 3D mammogram, which is something that looks closer and deeper into the breast tissue in order to find something that's abnormal.
So let's talk a little bit about black women. We know that black women, they have a harder time with breast cancer. Could you shed some light on that?
True. So breast cancer is actually a little less common, more like 1 in 10 women, but it's much more aggressive often and harder to find because of the densities that you mentioned. African American women are more likely to have denser breasts. So 3D mammograms are going to be actually more common and more useful in African American women. And it's something that, again, screening, checking, testing, seeing what is in there is going to be so important because people are often afraid too of getting breast cancer for obvious reasons, right? But if you detect a breast cancer either before it's palpable, before you can feel it, or when it's really small, the 5-year survival rate is over 99%. I mean, you are more likely to beat that than practically any other cancer if you catch it early.
What about, sorry to interrupt, I was just going to ask about people that are underinsured or uninsured. The mammogram battle is really, it's hard there because a lot of this isn't completely covered by insurance companies.
That's true, but there are healthcare facilities that will do mammograms for free. You can Google that. I mean, Google's, useful for so many things. Free mammograms are a thing. And another common myth that people ask me is, are mammograms dangerous, right? Is it going to cause breast cancer or cause cancer to get mammograms? It's not. The radiation that a person will receive during a mammogram is about the same amount of radiation that you will receive walking around in daily life for 2 months just out of your life. There's radiation in our whole world when we walk around, right? So 2 months of radiation on a daily basis is the same amount that you'll get from one mammogram once a year. It's not that much, and it's not cancer causing.
And do you have to go to your OB to get a to get an appointment, or do you have to go to your GP?
Either.
Okay.
Either one. And if you Google that free mammogram place, you can likely get an order from them. You can just show up, and whoever their healthcare provider is that's there can get you the order. And you need to follow up with your test results, because that's also a thing that's sometimes missed. You get the test, maybe there's a miscommunication or something where you think, oh, no news is good news. Never believe that. Get the news, make sure it's normal, because the last thing you want to find out is 2 years ago they detected a cancer and it was never diagnosed.
How often are you supposed to go, though?
Once a year.
Once a year, okay.
Some guidelines say every 2 years, but again, the guidelines say it's acceptable to get them once a year, and I think that that's the best way to do it because, again, early detection is key.
The biggest thing is taking control of your own health.
Yes, right. Taking ownership.
So it's always a pleasure with you being here, Dr. Wendy. Thank you so much. In just a little bit, make sure you keep up with Dr. Wendy on social media and visit her website, dreverywoman.com. But right now, she has a rap that can help everyone. Of course, we're going to be your hype man.
I love this. This is awesome.
Yes.
They call me Dr. Every Woman, but also Dr. Cardi MD.
I like it.
All right. Sister should press, fill up and down, round and throughout her whole breast. Why she won't check. If she check, we can catch and treat early, prevent. Put blood to the test. Ask auntie, how granny passed? She may know, she may not. Let's talk about it, I know it's a lot. I pull out my phone and take notes what you drop. Jeans when you born, might try to plot to get up in her business, secrets must stop. Grandpapa thinks he's exempt, but he's not. His colon health matters, put polyps on watch. Sisters be flexing, we think that we hot, but pull up that push up and check for a knot. Check on them regular, keep them on lock, just go round, round in a circle with stops. Recognize change and then go see your doc. She sent you to take a test, check them both out. Say if you wait for the symptoms to stop, just don't wait too long, treat that lump like it's hot. Press, 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 press. Won't she check both her breasts? Assess your risk, put concerns to rest. Call in, schedule your tests. Please tell me you won't forget. Mammal screens vital to your health. Bra up, check you, sis. Bra up, check you, sis.
That was awesome. Thank you so much, Dr.